Welcome back, my fellow lifestyle enthusiasts. If this is your first time visiting this channel, I'm Dr. Lene. It is my firm belief that your health, your time, your energy are really your true wealth. And by helping you to supercharge your health and to simplify your lifestyle, think less stress and less distraction, I aim to help you make room for your God-given mission in this life. That dream that's on your heart that only you can fulfill because it is unique to you. By serving you, I believe you can be better equipped to serve others. So if you're on a similar journey as I am, then buckle up and let's start living and loving our best life. Today in this video, I want to talk about cellulite. Chances are you have either come to terms and accepted it, or you've tried everything to get rid of it. Up until more recently, I struggled with cellulite most of my life. And more recently, I've managed to reduce it, although not entirely curing it, but I have managed to improve its appearance. So today, I hope to debunk some myths and share some unexpected but useful information regarding what cellulite is, how we get it, how you can treat it, and how I have treated my own. So if you're interested in an extraordinarily interesting video, depending on your outlook or experience with cellulite, then hey, stick around, give this video a thumbs up, and subscribe to this channel for more helpful wellness and lifestyle tutorials coming your way. We use the term cellulite to describe the lumps and the little dimples that we see on the skin that resemble orange peels or cottage cheese. While men and women both experience cellulite, between 80 and 90% of the population, primarily women, experience it. It's actually stable fat cells that are thought to be part of interstitial edema, or swelling and inflammation between the cells. We call this edematous fibrosclerotic paniculopathy. In addition to this swelling and inflammation, there are connective tissue fibers that hold the skin to the underlying muscle with layers of fat that are nestled around these cords of connective tissue. When fat cells swell or get larger, they push up against the skin while the tightened connective tissue cords pull down and cause this uneven appearance of the skin. What is interesting is that even the fittest, slimmest individuals can have cellulite, so it's not an obesity condition. And equally interesting is why cellulite is more common in women. Now, I need you to understand something. While we know what cellulite is, there is no full understanding of what causes the swelling, inflammation, and tightening of the connective tissue. The pathophysiology, or the disease process, is not understood. So please don't fall prey to folks over the social media realm claiming that they know what causes it and they have a miracle cure. Please understand as well that cellulite is not directly a function of excess weight, but it can be a genetic difference in the way that the adipose tissue, or fat cells, and connective tissue form. Despite the incomplete scientific understanding of all the causes of cellulite, we will discuss and model our treatment recommendations in this video upon the proposed theory that cellulite comes from the structural pattern of connective tissue, hormonal imbalances, genetics, inflammatory processes in the tissue, a lack of circulation and vascular integrity, and lifestyle habits. It has been shown that people who have cellulite have different patterns of connective tissue than people who don't. And men tend to have this pattern much less than women. Structurally speaking, in women, the fat cells and connective tissue in the subcutaneous layers where fat cells are located are arranged vertically. In men, the connective tissue has a crisscross structure, which may explain why men are less likely to have cellulite than women. The hormones associated with cellulite production include estrogen, insulin, noradrenaline, thyroid hormones, and prolactin. We need estrogen to have plump, dewy skin. With a decrease in estrogen, we have a decrease in blood flow to the tissues under the skin. Lower circulation causes lower oxygenation to the tissues, and thus it lowers collagen production. Lowering of estrogen can therefore contribute to the growth of fat cells. Now, genetics can potentially be a contributing factor because genetics, again, can determine the speed of metabolism, the distribution of your fat, and circulatory levels, as well as your collagen formation. People who eat too much inflammatory fats have greater amounts of cellulite. Inflammatory diets include foods that are riddled with inflammatory oils, such as soybean, canola, cottonseed, corn, sunflower, safflower, peanut, vegetables, oils, as well as simple carbohydrates, corn syrup, sugars, too much fat, and too little fiber. Cellulite may also be more prevalent in smokers, those who do not exercise, and those who sit or stand in one position for a long period of time, kind of like what I'm doing now. People who have poor circulation and lack of lymphatic drainage are also susceptible. While some of us love our Spanx and our shapewear, wearing underwear with tight elastic across the buttocks can limit blood flow, and this may actually contribute to the formation of cellulite. So while we love constriction for the way it smooths out our surfaces, ironically, we are exacerbating the potential cause of exactly what we're trying to hide. The American Academy of Dermatology has reviewed a number of methods that may be successful at reducing the appearance of cellulite by breaking up the connective tissue under the dermis, or the skin surface. I'm going to review some of these treatments as described by Medical News Today. I'll link the resources for you in the description box down below. Acoustic wave therapy uses a handheld device to transmit sound waves. It may work, but it can take several sessions. Laser treatment may improve the appearance of cellulite for a few years or more. It involves inserting a very small laser probe under the skin. Subcision involves a dermatologist putting a needle under the skin to break up the connective tissue bands. Results can last 2 years or more, according to the AAD. Vacuum-assisted precise tissue release cuts the bands using a device containing small blades. As it cuts the connective tissue bands, the tissue underneath moves up and fills the space underlying the skin, removing the appearance of cellulite. This may last for up to 3 years, but data on it is really limited. Carboxytherapy involves inserting carbon dioxide gas under the skin. Side effects include bruising and discomfort after the procedure, but some cellulite might disappear. Endermology involves a deep massage with a vacuum-like device that lifts the skin. The United States Food and Drug Administration has approved it as safe, but there is little evidence that it works, says the AAD. Some folks have used cupping to achieve these benefits as well. Let's talk about what doesn't work. Techniques that the AAD do not recommend include cryolipolysis, which freezes fat, mesotherapy, which involves injecting a mixture of substances under the skin, alternative or supplemental therapies that are caffeine, grapeseed extract, ginkgo biloba. Actually, these agents have been applied topically and taken orally, as well as injection, but none of them have been proven effective. Some medications and creams have been proposed because they act on fatty tissues. For example, caffeine dehydrates cells, making them less visible, but this needs to be applied daily. Various caffeine creams for cellulite are available for purchase online. You can even make a coffee scrub at home. While some people swear by coffee scrubs, the effects are temporary, and I cannot speak from personal experience to the efficacy. Some people wear compression garments to reduce the appearance of cellulite. These garments try to compress arteries and increase blood and lymphatic flow to reduce visible cellulite. Compression stockings and other garments may be purchased online. The concept here is that with these garments, it's that you're improving lymphatic flow. You can try this, but I have a better option for you coming up. Liposuction and dieting do not remove cellulite because it does not affect the structure of the connective tissue. Let me repeat that. Liposuction does not affect the connective tissue. Likewise, no studies published in medical literature have supported the claims that a special diet for cellulite will decrease its appearance. Experts have concluded that eating a healthy diet can decrease fluid retention and improve the overall health and appearance of the skin. But specific diets designed to target cellulite are of no value. So the next time someone tells you that they simply cleared cellulite with diet, they're not telling you the whole truth. Yes, losing weight and reducing your body's fat composition will dramatically help to reduce the appearance of cellulite. It will not improve the connective tissue. Another popular treatment is body wraps, and many salons offer herbal or other types of body wraps as treatments for cellulite. As is the case with cellulite diets, controlled studies in the medical literature have not proven the effects of wraps. While wraps may decrease fluid retention and improve the overall appearance of the skin, these effects are temporary. So in summary, despite multiple therapeutic approaches that attempt to reduce cellulite, no procedures have been scientifically proven to be successful long term. You should know that all topical agents, injectable treatments, and energy-based devices can improve the appearance of cellulite, sometimes to a satisfactory degree, but never completely eradicate cellulite because to do so would require extensive tissue remodeling. So let's talk about what does work. In my opinion, you need to address this multifaceted issue with multi-purpose internal and external methods. More large-scale studies, especially with combination therapies, need to be conducted to evaluate long-term results in terms of safety, efficacy, and patient satisfaction. With the lack of scientific studies involving multifaceted treatments in my mind, let's talk about my personal experience and what has worked for me. Given that we believe that cellulite may be caused by a reduction of lymphatic flow and circulation, tightening of the collagen fibers, decreased strength of the skin, inflammation and hormone balance, I'm going to choose to attempt to reduce mine by attacking as many of these issues at once as humanly possible. So here is my 5-part method. First, I eat a non-inflammatory diet void of sugar, grains, poor quality meats, dairy products, and inflammatory oils. If you want to know my exact diet, you can grab my free book in the link down below or watch my videos that discuss how I eat, and I'll put that playlist for you up here. I aim to eat as many green veggies as possible, as the increased amount of potassium provided in these foods significantly decreases water retention, improves lymphatic flow, and the proper hydration of cells. I also eat foods that regulate hormone balance, especially insulin. Musculoskeletal training has been really beneficial. My favorite training involves waking up all of the accessory or stabilization muscles. Such methods such as Tracy Anderson, Callan Pinkney's Callanetics, and Pilates or bar, and some forms of yoga are beneficial for strengthening and toning these particular muscles. For example, in just 10 sessions of Callanetics, you can dramatically reduce the appearance of cellulite in my own experience. I have tried retinols. As I mentioned, they do work, but I'm really too lazy to apply them daily, and the effects seem to be very temporary. Retinol may reduce the appearance of cellulite by thickening the skin, but we're not really sure. It's important that you do a patch test though if you're going to use a retinol, because your skin can be really sensitive to it. Retinol treatments are available to buy online, but it's my recommendation that you make sure that it's physician or pharmaceutical grade, as you're just wasting your money if it's not. Over-the-counter creams and lotions are not required to meet the standards that physician grade or pharmaceutical grade treatments must meet in order to be prescribed. I actually have seen great results with retinol creams, and we use one at our clinic. I would say that it takes about 2 months to see results with daily application. I'll put that link for you down in the description box as well if you're interested. Now, I have dabbled in technology, primarily radio frequency. I specifically used Cutera's TrueSculpt, which at this time is the only FDA-approved device to reduce fat in a given area up to 24% in just one treatment. It also is FDA-approved to tighten the tissue. At our clinic, we chose this device over the competitors because we were waiting for a treatment that was quick, comfortable, and effective. It literally takes 15 minutes and feels like a hot stone massage. So it's really easy and there's no downtime. The biggest change I saw was after 2 months of jumping on my Cellulite daily. I did own a bungee cord rebounder prior to my Cellulite, and I'm not here to argue the types of rebounders or the quality of rebounders on the market. If you have a rebounder that you love and you use it regularly, you are far ahead of the curve when it comes to health, and I applaud you. If you're on Team Rebounder, then you are my peeps. I will say I used the bungee cord rebounder for years and I noticed no change in my cellulite. But after 2 months of jumping on the Cellulite, I noticed a drastic change. My hypothesis for this dramatic change with one piece of equipment is really this: there's no better way to dramatically move lymphatic flow and circulation than rebounding. In addition, rebounding promotes the normalization of hormone production. Your thyroids, adrenals, pituitary, and other glands are gently massaged while you're rebounding. There is no other way to gently stimulate the production of hormones without the use of nutraceuticals, botanicals, or pharmaceuticals. Also, rebounding reduces inflammation in the body, including the cellular inflammation that we're trying to target. It also gets joint inflammation and inflammation in the tissues and organs. For this reason, it's one of the best treatments for a disease process associated with inflammation in combination with the diet. As an added bonus, rebounding is one of the best ways to detoxify your tissues and to rid the body of waste and increase oxygenation to your tissues and every cell of your body. Here's the kicker. If cellulite is caused by weakened tissue on the surface and tightened collagen below the surface of the skin, when you bounce, you gently stretch and strengthen every collagen fiber in your body. There is no other way to do this that I know of other than to use the power of the gravitational force and to bear weight on every cell in your body with the contact of the mat. So for this, and because I have experienced it firsthand, rebounding and diet are my primary non-invasive and inexpensive methods for quickly improving the appearance of cellulite. So to help you out, I have a resource for you. I have a free 3-part video series to help you start burning fat right now. You can click that link in the description box and start your series today. I also have a free book for you called The Forever Fat Burner to help you debunk a lot of the noise in the media about how we can lose weight and burn more fat. The fee associated with the book, just so you know, covers the printing, shipping, and the handling of the book. And if you need help with your exercise, especially finding what I like to call that minimum effective dose for fat loss, I have linked a few tips for you up here and also in the description box down below. Of course, if you're researching rebounders, I'll put a link for you to check out in the description box as well. More importantly, if you have cellulite and you struggle with body image or you're embarrassed by it, I need you to know that you are beautiful, perfect, and unconditionally loved just the way you are. Say this affirmation on a daily basis to yourself. This is the most important affirmation that I teach my weight loss patients and my clients to say daily. If you need help with mindset, you can check out this video here to get you started, or join the folks who have successfully graduated from my Mindset Masterclass, and I'll put this link down below for you as well. Congratulations. You have just taken the time to educate or remind yourself of some simple things that you can do to start improving the appearance of cellulite right now. Your body is a sanctuary and should be the tool used to help you pursue your dreams and fulfill your mission in this life. Cellulite is not a bad thing, and it's not detrimental to your health. Don't forget that every day you need to be thankful for this vessel that you have, and don't allow those negative thoughts to creep in. And please don't forget to share this video with a friend or family member you think will benefit from this information. If you liked this information and felt that it was beneficial, give this video a thumbs up. Subscribe to this channel if you would like more health, wellness, and lifestyle tutorials. And please leave me a comment down below and let me know what tips you found useful. I can't wait to see you in the next video. Mwah.